So it's not over, and this is just a symptom of a bigger problem. COVID was. It just demonstrated to us a bigger issue because these mechanisms were put in place to handle more than just COVID. And we can see that in the documentation and the way that they've set up stuff like the behavioral science office to handle future pandemics. So this isn't just a one-off here. These processes were put in place. They were very thoroughly tested, and just like H1N1, they found out the people they needed to target and silence, and that.
In today's report, you will meet Natasha Gonek. She's an Alberta-based medical and regulatory investigator with an eye for evidence and a determination to find the truth. After losing her job due to COVID-19 vaccine mandates, she turned her investigative skills toward uncovering the who, the what, and the why behind pandemic policy in Canada, and she's been trying to pull back the curtain on the decision-making, the messaging, and manipulation behind the federal response ever since.
His investigations on the civilian side. So I was with the Office of the Chief Medical Examiner in Alberta for quite a long time as a on-staff investigator, where I was investigating sudden deaths. Was also in the regulatory world. So as a regulatory investigator, looking at healthcare professionals who had misconduct or practice issues, and not only doing resolutions, but doing full investigations on that pathway, writing, submitting reports, the usual, extensive research and, looking for evidence. And that's kind of been my background. I also have occupational health and safety training. And when I was first out of university, I started the heart valve procurement program for way back in the day, Capital Health Authority. And so that was in relation to transplant services. And so my background has been extremely heavy in the medical side and looking at investigating medical practices, errors, procedures, policy, seeing when things don't add up. And so what kind of led me into this was, number one, I was one of the casualties of the COVID measures and the employer mandates while I was with one of the regulators. And so they actually gave me a lot of spare time. And I'm sure a lot of people are probably pretty upset about that at this point, but it led to me looking and researching and really diving into that, because while I was doing investigations for the regulator and dealing with frontline workers, whether they were nurses or doctors throughout the pandemic, I was getting the feedback and having the conversations with people who were in the units and were telling, what those updates were. And they would have lengthy discussions about the concerns that they were having, the differences in what the media was saying versus what was actually happening in the hospital. And, those are all very substantial red flags. It was a red flag for me from the beginning. And so, just the whole, the way the narrative was groomed was quite substantial. And I was flagging documents to the employers very early on, just saying, hey, something's not right here. Alberta Health Services shouldn't be putting out a document that says attitudes and adherence to COVID measures in September of 2020. And it's a behavioral science and a behavioral nudge document. And so those types of things really led me on a path to dig and to archive it all as evidence.
Natasha's background in investigations gave her a front row seat to how systems should work and what happens when they don't. Her findings have helped people in court and others searching for answers, but they also reveal a troubling pattern of data suppression, behavioral manipulation, and top-down decisions that bypassed public consults.
How did these decisions get made? Because there were so many layers of working groups. And I've even had some of the ATIP people comment to me, why were there so many working groups and pockets of people as I start requesting more committees? So, we had, of course, most people know we had PHAC and we had Health Canada and we had the Innovation Science Economic Development Group sitting at the top. We had the Privy Council office, the NACI sitting at the top. So these are your top of the food chain people, but where were they getting their information from? And that was what I was trying to flesh out, because these committees, as they reported, they were not just small working groups. So that's what people really, it's important to understand that you had groups like the Vaccine Vigilance Working Group, the Vaccine Surveillance working groups. You had, the immunization committees all sitting there. You had causality committees for vaccine injuries. You had background rate working groups. You had the coroners and medical examiners working groups to assess the deaths. It layers and layers, but I was trying to get back to who do they end up reporting to. There was this committee put together, and they were just a multidisciplinary group of experts from across the country. And you can actually look up their page. They have all of the bios and everything, and it had some of the top immunologists, top scientists, top people working in the industry of vaccine industry. So these were people in that vaccine industry on that COVID-19 immunity task force group. And they were they were tasked with a mandate to help the government of Canada make sound evidence-based decisions. And so this group was started in 2020, and there's meeting minutes that go all the way back through, but they were directing funding for research. They were directing funding for, say, like the biotech companies for Canadian-based vaccine options or therapeutic options. They were directing funding and projects for how do we create the communication strategy to not have vaccine hesitancy. And those conversations, I was reviewing some of them today. They're tough to read because they actually, almost make you feel a little bit sick to see the behavioral approach that they were taking. And they were grooming those messages in July and August of 2020, where they were having meetings at that high level to be able to ensure that there wasn't vaccine hesitancy and who did they need to target. And they were getting presentations from external parties. And then they were writing that into their letter of their meetings up to the Minister of Innovation, Science and Industry, and to the Minister of Health at the federal level.
Internal government documents from the summer of 2020 reveal a behavioral strategy focused not on transparency, but persuasion. Even before the rollout of the novel, modified RNA injections that were rushed to market, messaging was being coordinated across all levels of government to foster trust and suppress what they call vaccine hesitancy. Even while officials admitted in meetings they lacked long-term data and adequate adverse events tracking. None of this embodied informed consent. It was psychological conditioning and manipulation.
When you start reading it through, it then leads back into they had these units called the Impact and Innovation Unit, and the Privy Council office, who were doing surveys to determine the attitudes towards vaccine hesitancy, and who they had to target to be able to ensure that that they could address any of those concerns. They were also really grooming that message, wanting to control the messaging in the provinces. And it was interesting because in August of 2020, when I was reviewing some of these documents again, I was just looking at it going, what were they saying at that time, and it was to reinforce this, this message here: reinforce consistent and coordinated messaging at all orders of government, recognizing that trust in government is a key determinant in vaccine acceptance. In this regard, federal, provincial, territorial, and municipal messaging should focus on assurance to the public on safety, including, importantly, the monitoring of safety after the commencement of the immunization program. Transparency and honesty about the limits of what is known will be essential here. Well, they didn't do that. They're also talking about how the paragraph above, how to robustly handle disinformation and misinformation campaigns in a manner that don't undermine, the vaccine information campaign that they were doing. I mean, they're having these conversations about grooming the message to the public and maintaining that consistency while they're sitting there saying we don't have long-term evidence. And that's in these documents as well. We don't know the long-term effects of these. They're still in clinical trials. They haven't been tested on special interest groups or special populations. And, that's concerning, because as they're saying that and saying they need better tracking, and that Canada doesn't have a good system for really having wholesome vaccine surveillance for adverse events. They're talking about now grooming that message to the population. And how do they do that without jeopardizing the rollout of these shots? Like, that in itself should be enough to launch investigations across Canada.
Speaking of investigations, these so-called experts who were celebrated as industry leaders compromised their ethics and abandoned due diligence. While shaping public perception, they knowingly dismissed ethical standards, inflicting harm through psychological operations and mass-scale mind control techniques. Entire government behavioral science teams sought a trusted group to carry the message, making them the principal messengers of the COVID-19 vaccine campaign. They specifically targeted physicians, nurses, midwives, physiotherapists, pharmacists, and other health professionals to ensure vaccine promotion. So why aren't there investigations into all of this?
As law enforcement, based on my Edmonton Police Service report on their pandemic, where the Edmonton Police Service members, sworn members and civilians, hired me to assess their 9,000 pages of FOIP documents. It demonstrated in there that they were working collaboratively with knowledge of the measures being implemented on the public, not having the ability to withstand a test in court. And that was well documented in their meeting minutes with multiple levels of provincial government. So, you sit there and go, they still haven't even acknowledged that they caused harm to their own members who have submitted written statements of harm. Their union hasn't supported them on that either. And they're being left to blow in the wind. And a lot of them have been injured. They have illness. They are worried or scared. They don't even know what to do. They don't get treatment. I mean, this is our law enforcement, and they're being, their health is being compromised because of the measures put onto them. And so we're really sitting with, if your police leadership was involved or had knowledge of or put this onto their membership, well, they can't do the investigations. So I don't know who you go. You would have to go to teams of specialized independent investigators who would put a proper lens on it. I mean, it's not a witch hunt, but we do need to address that there were decisions made, that there were people harmed. And it's not small volumes, as you've seen, of adverse events. They're talking about it, before these shots rolled out to the public. They knew the large volumes, they knew the bad batches, they were monitoring the sheer volume of anaphylaxis in certain lot numbers, myocarditis, thrombolytic events. I mean, this is before, and this is still in that staged rollout, the phased rollout. So we have to go and address why they didn't pump the brakes. And that needs an investigation.
And now the government is trying to run cover for who was responsible for certain decisions. But Natasha and others are still seeking accountability through access to information requests and through official, legally binding government communication called order paper questions in the House of Commons, which are publicly available.
But what we're finding on these, and you will notice when you start to read them, is that the questions aren't getting answered, or they're very limited answer, and a lot of skirting to, well, that was a provincial thing. And so instead of telling you who was handling that, they just skirted off, well, that was under the provincial mandate. So they aren't giving you the names of people involved. And in fact, I'm finding now, and you would have noticed this when you went through my Proton drive, was that previously in the meetings, they were listing the federal employees' names from PHAC or from NACI or whoever, whichever Health Canada agency, whoever was sitting in those meetings. Now I get an ATIP back, and they're now redacting those names that were there before. Even documents that they've re-released to me, sometimes in error, sometimes I've asked for a cleaner copy, and then it'll come with the names redacted, yet I already have a copy that the names were on. So they're really trying to, people are trying to hide that. And when I asked for clarification on that, they actually referenced a piece of the access to information legislation and said that they were worried about their employees' safety. And, that for me, I went, okay, well, that's telling me people are worried that they've done something wrong, and they don't want their name attached to it, especially now that there's so much disclosure. But also, where was the concern about the general public?
Natasha further notes that during COVID, the courts didn't just stay silent. They followed top-down directives from a judiciary-led COVID committee chaired by Chief Justice Wagner. Judges were removing parental rights over medical decisions, refusing to even look at early evidence. It wasn't justice, it was compliance. And now the institutions meant to hold power accountable are the very ones who enabled the harm. So the question is, when the courts are compromised and oversight bodies participated while law enforcement stayed silent, where do you go for accountability? For now, people like Natasha and others are gathering, archiving, and organizing the receipts because eventually, she says, the pathway to accountability will open, and when it does, she'll be ready. Natasha leaves with a final message for anyone who thinks that COVID is over and wants to just move on without addressing the serious harms inflicted.
It's definitely not. You obviously have not been to a care home, if you believe that, or to a hospital, because long-term care facilities are still causing harm to patients. They're still locking them down for one positive test swab. If you can imagine that they're still thinking and using a PCR test to do that. And so it's not over. And this is just a symptom of a bigger problem. COVID was. It just demonstrated to us a bigger issue because these mechanisms were put in place to handle more than just COVID. And we can see that in the documentation and the way that they've set up stuff like the behavioral science office to handle future pandemics. So this isn't just a one-off here. These processes were put in place. They were very thoroughly tested, and just like H1N1, they found out the people they needed to target and silence. And thank you very much for having me and for continuing to do amazing investigative journalism, because it's something that we definitely need right now, and people have kind of moved on from this, but you don't get to just move on from something when we have so many people hurt and suffering and not knowing where to go and not getting proper care.
To catch all of our reports on the topic of these novel modified RNA injections, head on over to nomoreshots.ca. There you can even sign our petition geared toward the federal Minister of Health, calling on market revocation of these injections. All of that and more at nomoreshots.ca.